He says staff at NGOs are going unpaid while children are suffering. Following the report of the Health Ombudsman on death of former esidimeni patients, 9 additional requirements were added for licensing of NGOs. Bloom says the department is being unreasonable in not giving sufficient time for NGOs to meet the new requirements. Now, to speak more on this issue, we are now joined on the line by Jack Bloom, the DA's Shadow MEC on Health in the Gauteng province. Jack, thank you so much for joining us. Now, to your knowledge, did the Gauteng Health Department engage the NGOs before pulling the plug on their funding?
Well, not at all. In fact, the consultation process was most inadequate. Last week, Wednesday, there was a big meeting with all the NGOs, and they were told, no, you've got to comply, at once. Look, there's 9 more conditions that they have to meet. So one of them is rezoning or zoning. And that alone can take a couple of months, if not years, because you're dealing with the city council. So the department's been quite unreasonable, and the problem is that they've cut funding in the meantime. So they gave them very short notice of what criteria they had to meet, and then they pulled the plug. Now, we know that this is unreasonable because the court has already ruled on this. One of the NGOs took the Gauteng Health Department to court last week to force payment, and they won their case. So they could afford a lawyer, and they've gone to court, and other NGOs are going to court. But I don't know if all the other 160 NGOs could do this, but clearly the department is not giving enough time to these NGOs to meet the requirements, but cutting off their funds in the meantime is terrible. I mean, it's 3 months now that they've been without the income from the department, and some of these NGOs can't even feed their patients properly, and some have even sent them away.
Now, Jack, are the new requirements being set by government not an attempt to avoid another tragedy like the one that happened after patients were moved from life esidimeni?
Yes, they are. It's added requirements, but you must understand that these NGOs are not like the ones where the esidimeni patients died, which were neglectful in every aspect. These are well-established NGOs, and I'm sure that the vast majority of them could comply in reasonable time, but you're not helping them if you cut payments in the meantime. They're only getting 3,400 Rand a month per patient, which is a lot less than what the government now pays for, ironically, esidimeni, where they've put a lot of the mental health patients. They pay them 15,000 Rand a month in the Selby Park Hospital as well, where a lot of the patients are relocated. These are higher-level functioning patients. There's about 6,000 of them in these various NGOs who are doing a good job on the whole. But in order to meet the more stringent requirements, they need a bit of time, and you can't cut their funding in the meantime. I think this is what's so unfair, that the department has cut the funding totally. So I don't know what they want to achieve by this, because these well-established NGOs could just, fold up. And then what is the government going to do with all the people that were living there?
Now, Jack, how long had the government given these NGOs time to comply with the new requirements?
Well, they weren't given proper details, and some of the NGOs tell me that, very little indeed. In fact, what happened at the end of March, the funding was totally cut. They had no notice of that at all, in fact. So the funding was cut at the end of March, and, some of these new requirements like zoning are naturally going to take a couple of months. Now, zoning doesn't affect the treatment. It doesn't have any bearing on how they're treating their patients. It's an external compliance that's related to municipal zoning laws. Now, I mean, obviously they should comply, but the department on this one requirement alone can't expect them to do it overnight. So I think it is a crisis situation, and ironically, by bringing in new, more stringent requirements but not paying, I think there could be another esidimeni happening here, because patients are not going to be well treated if the NGOs are not being paid their subsidy.
Jack, what would be an ideal situation for the Gauteng Department to handle the situation? What would you have liked to see happening?
Well, I think they shouldn't have done it in a punitive way, and they should certainly never have cut off the funding. They should have sat down with each NGO and worked out a timetable, a reasonable timetable to meet the new requirements. And everybody should have stuck to that timetable, but that's not how it was handled at all. There was not good communication in this, and I'm sure that most of these NGOs can comply, but in the meantime, I mean, they simply cannot function. You know, how could anybody function if they weren't given pay for 3 months? And they are looking after vulnerable people, and I really think that there needs to be a rethink by the department. I mean, firstly, they've got to restore the funding, and then I'm sure all the new licensing requirements can be complied with in good time.
Jack, has there been any reaction from the Health Department with regards to them cutting the funding to a lot of these NGOs, and from your reaction as well?
Well, they've been very hard-hearted about it. As I said, they met with a whole lot of the NGOs last week, Wednesday, at the Westkoppies hospital, and they were told to comply or not, you know, that they were told to comply virtually immediately, and the objections, the reasonable objections, are not held out. I don't know what's going on with the Gauteng Health Department. You know, they really are not communicating properly. We're currently, 3 weeks of a mortuary strike that could have been identified. So there's a lack of leadership in the Gauteng Health Department, and this could really have been avoided with proper discussion and consultation and reasonable time frames. So I'd really appeal to the Gauteng Health Department. First of all, you have to restore funding. It's just totally unfair that these organizations haven't had any funding, and then sit down with them and have a reasonable timetable so that they could comply with the new requirements.
Jack, very quickly, since the Life Esidimeni tragedy, are there any noticeable improvements within the Gauteng health sector?
Well, what happened then is that, as you know, all the former Life Esidimeni patients were transferred to very unsuitable NGOs, not the NGOs that we're talking about here, and now virtually all of them have been relocated back to Esidimeni or to Selby Park Hospital, and the rate the department is paying is 50,000 Rand a patient there. So I think that's a big improvement, but now that's on the one hand. On the other hand, they're undermining some very good NGOs who are doing very good work, and the problem is they still haven't completed the disciplinary disciplinary processes for senior department officials. That's why we don't have a new permanent head of department. We've got a lot of acting people at the Gauteng Health Department because the disciplinary process against those involved in Esidimeni is still continuing. So I think there's a lack of leadership from the NEC. There is a problem with appointing new people, but honestly, I really think that the department's not handling this latest situation very well at all.
Jack, we'll have to leave it there for now. Thank you so much for joining us. That was Jack Bloom, DA Shadow MEC on Health in the Gauteng province, joining us on the line.